Thanks for staying with us. So, International Day to End the Obstetric Fistula with the theme Women's Rights are Human Rights. End Fistula now. This is one of the most serious and tragic childbirth injuries women experience. Joining us now on the show to explain further is a medical doctor, Dr. Femi Ogunremi. Welcome to the show, sir.
Thank you.
Good to have you.
Pleasure.
You can call us on 09139076948. You can also call us on 08127053687. You can tweet to us at TVC Connect. Please hashtag your View TVC so we can read your tweets. All right, so we've discussed obstetric fistula quite a few times, but it's always important that every year we remind Nigerians the importance of this medical condition. Could you tell us, for those who have no idea what obstetric fistula is, what exactly is it, and how and why is it such a dangerous thing for women?
Okay, so obstetric fistula is, maybe before I do that, let us know the anatomy of human ladies' birth canal. So we have the uterus, which is like a tube, inverted sac. And then in front of the uterus is the bladder. And at the back, we have the rectum, which is where the poo comes out from. So the bladder is where the wee comes out from. So you have this bag that carries the baby is in between two other, sacs. So when we talk about obstetric fistula, we're talking about an abnormal connection between the bladder and the vaginal wall. And then at the back, the connection between the vaginal wall and the rectum. So normally there shouldn't be that connection, but in a fistulous situation like this, there is a connection. And this connection happens because of a lot of the time, because of a prolonged bad problem. So a lady wants to give birth to a baby, the baby's head comes down into the birth canal, and then normally the head flips out through the vagina, and then you have the baby delivered. But in certain situations, there is a delay in this process. So there's the kind of an arrest of the baby's head in between the pubic bone, the bones that supports the hip of the lady. So you now have the head arrested and then pressing on the structure that is in front of it, which is the bladder. So when that happens for a very long time, you can imagine if you press your finger on any part of your body, it looks white because you push blood away from it. So there will be, absence of blood in that area for a long time. And then when you do that for a very, very long time, then the tissue then dies. So later on, it creates such abnormal connection. And there are other things that causes it. It might be, which we can talk about later, it could be maybe what we call heterogeneous situation, where during the process of surgery, then the doctor himself accidentally punctured that area. So there are gamut of things that causes that. But in a nutshell, the fistula that we're talking about is the abnormal connection between the vagina and the bladder, which leads to continuous discharge of urine through this canal, which is not supposed to be. Or if at the back, it sort of creates a connection between the rectum and the vagina, and then there'll be physics all the time.
So how is it detected early? How soon do you detect it as a pregnant woman?
So usually it's not something that happens straight away after childbirth, and unfortunately, the people that get, that have this condition, they're people of low socioeconomic class, they're people who are not educated, there are ladies who are living in the rural place. So this thing carried on for a very long time. So after the birth, what happens is if there's a blood, there's a wound that creates in that area. It's not something that you see immediately. So it takes some time after birth. And that period of time varies.
Now, so is there hope for a woman that has this fistula? Does it have like a cure?
Yes, it has a cure, and it will involve surgery. But before we talk about the cure, I think the most important thing is we have to prevent it from happening. That's the major thing. So, and that's where there's a lot of things that has to be put in place. Female education is really key, because when we talk about conditions that leads to, situations that are associated with this condition, things like a a lady that is short, you know, when you have early birth, I mean, people that have going to pregnancy very early in life, when the hip is not big enough, or if you have malnutrition or things like that. So if you educate the lady about such situation, you can prevent it. But in situation when this has happened, yes, there are surgery that can be done.
Yes, talk away.
Okay, so I wanted to ask, because, you know, we've discussed this thing several times, and there's even a movie that was done that generated a lot of awareness concerning it. It is a very preventable situation, and it is also a it's something that can be cured. What can we, aside the education, which is very important, how can we let people raise the awareness of people who are already pregnant into preparing themselves to avoid this kind of situation? And what can be done if you're already pregnant, you're a teenager, you're pregnant, and you might be suspecting this might be your case? What can you do to avoid the obstetric fistula from being your condition after childbirth?
Thank you for that. I think awareness is the major thing. So when we're aware of it, just like you said, then we can, you know, such patients we need to register with, you know, with in proper hospital where they can do a proper follow-up. Because the reason why this happens is a lady comes in, obviously you can assess the, you know, there are some early assessment that we do to check whether the birth canal is actually adequate for the baby to come out.
Yeah, ratio of baby to the hip.
To the hip. The head of the baby to the hip. You know, that's very, very important to assess. And then when you look at their heights, and then there are certain things that can be done pre-natal. So when they're doing the prenatal assessment, this can be picked early. And then if we know that a lady cannot actually go through that process, then the alternative is to have a cesarean section.
Okay. The doctor can puncture that place by mistake. What now happens?
Okay, so there are a lot of this happen. Unfortunately, you know, being a doctor, we're not actually good. And then errors are bound to happen. It will happen. No matter what we say here or they do or you do, errors can happen. So there are certain situations that maybe even when during the course of birth, you know, process, we use some instruments to extract the baby when babies can't come out. And accidentally during that process, you want to do good, but unfortunately this happens. It does happen. And then sometimes if it's the bladder, we pick it early, and there's just simple process of putting a catheter in and watch things for a period of time. Then the bladder can heal itself. Right. You understand? If we pick it early. But in a situation where we do not even know we miss it, then this can then cause problem.
You're explaining something, and I'm just walking back.
All right.
So there should be a process where a doctor looks at a person and says, this is my own professional advice to you. So when I was pregnant with my first child, if a doctor had said to me clearly, Madam, don't dare natural delivery, this is the consequence, clearly, I know myself, I will run away. But, you know, when you just say, you have a tiny cervix, you have a tiny waist, okay, maybe, you know, and like we're joking, and then we have a long labor, 14 hours of labor. You then have to resort to certain methods to assist the baby because the baby had crowned already. You then have to, and then you cause somebody's cervix and you say you missed it, you know? And the person then has to live the lifelong consequence of that, you know? It's something that I don't find.
I think, Alaja, I can pick what you're saying, and I say this to my colleagues. You see, medicine has advanced to a stage now that we have to put patient at the center, you know, of care. So whatever we do, we have to be patient-centered. And when we say patient-centered, when you're patient-centered, you know, approach means that you educate your patients. And I agree with you. There should be a kind of dialogue. There should be a kind of
full disclosure.
Yeah, you need to. And this is an advice to my colleagues because I see this happen. So we need to engage our patients. Patient needs to know your decision. Any adult is allowed to be stupid. I say this all the time. People laugh. If you can process things, you can understand things, you can juggle things, you can reproduce it back to me, you're allowed to be stupid as an adult. If I give you everything, it's not my decision to take that decision for you because it's your body. So I always encourage colleagues that, you know, we give everything to the patient to be able to know the pros and the cons, And in the
Especially
end,
when you're highly paid.
Well, I don't know about that, but you know, that's the appropriate thing that needs to be done, and I think that's lacking a lot in some of
Thank you for bringing that, because there was that season of secrecy where doctors feel as if don't tell you, don't worry,
we know what we're doing.
Ignorance. But we're in that season where you must speak, talk to your patients. Yes. But I want to talk to you about the stigma. You know, in certain communities, because we were just talking earlier that in certain areas we don't have enough doctors, we don't have enough physicians that can help to quickly diagnose these things. So women have to live with the stigma of where they can't control the urine that comes out of the uterus. Abandoned. So what are you, doctors like you, what are you doing to help those who are in the rural areas, to help women, to educate them on how to get help concerning this?
Yeah, so I think this is a national issue, because if we look at I think Nigeria has a very, about 2 million to 3 million people that suffer this condition. About 1 million people are in Nigeria. So we have a very large community of people with this condition. And I know there's a lot that is being done, like, you know, in different areas. It's kind of polarized. Areas where you find this more like in the north, in places where they do early marriage, children. So the things to do, it's not only from the doctor's angle. I think policies have to be in place. The government has to be drawn into this. It's not something that you say, yeah, it's the doctor. No, the public enlightenment has to come through programs like this and things that, you know, advocacy that the government will put in place in places where you have this being quite endemic and quite, you know, pronounced. So I think things that it has to be an intercollaboration, not just something that would leave to the doctor. Yeah. The doctors come into place when issue had already happened. For enlightenment of ladies, educating them, putting policy in place and structure has to come from the government.
What about enlightenment of culture, people with cultural stereotypical look to things? People who believe that it's either a punishment for what the woman must have done. You know, some people call it some abortion consequence or some past consequence, and then they tag the victim who suffers this condition as someone that should be cast away, you know, such things. It's other people doing it to the victim now. What kind of sensitization do we need to give to people to see it as a medical condition, first of all?
I think, again, education. Public, victims, and, you know, all the laws, everybody that's involved has to be aware, because it's not this lady's fault. Unfortunately, like I said, the people that are part of it are the people in the low social, you know, economic, you know, class, and obviously the cultural situation that happened there. And they're not in school, they're in the rural places. How we then get this across, you know, to those areas is what we now have to work with, with the government.
Let me take this call. Good morning, are you there? Hello?
Hello?
You're live. Go ahead, please.
Yeah, I want to contribute to the discussion that is going on.
Yes, go ahead, Gold. You're live. Yes.
Okay, I'm a first-time caller.
Welcome to the show.
Thank you very much. My name is Gold. I just want the doctor to explain to us, you know, situations that, you know, happen with pregnant women when they say they have breech pregnancy. So in most cases in our country, you know, people used to associate that kind of thing to witchcraft, but I know it's not supposed to be like that. What is the cause of it? Because most women die, you know, during childbirth because they have this breech pregnancy, which wasn't taken care of before the time of delivery. And
Thank you very much, Gold. So do we see that situation whereby mothers die because they have a breached pregnancy?
Okay, so when we talk about breech pregnancy, you see, the normal way that baby comes is you have the leg up and the head down. You understand? So at certain stage during pregnancy, baby roll and they turn and they move, like mommy feel the baby moving. So, or at a particular stage, towards the end of the pregnancy, we expect the head to be down, where the head can then descend and then can, you know, go through the birth process. But in a breech situation, an abnormal part of the body is presenting first. For instance, it might be the leg, which is the foot, a breech that comes with the foot. It can be the arm. It could be, you know, the shoulder. So those are, and then what triggers, delivery is a pressure at the late stage of pregnancy. The pressure that irritates the birth canal, and then that leads to, the baby's head to maneuver through that canal. So when you have the hand, for instance, is not run like the head that can sit in a position and push and put pressure. So that can put pressure. The lady then cannot, without assistance, deliver that baby. You understand? So the baby cannot come because there's no pressure. There's no how you're going to get the baby out.
When those movies say, oh, she's been pregnant for 10 months, it's possible that the baby is breached.
Yeah,
that's why there's no pressure that the baby can't come out. Or when somebody tells you somebody's pregnant for 10 months,
2 years.
The baby
no the one that we have not heard before.
Possible.
2 years.
Some people carry this.
That's impossible, right?
Well, from the clinical perspective, it's so difficult for me to explain to you.
I've heard that. For 10 years, right?
Yeah.
10 months, I mean.
Yeah, 10 months is still, people can have, that can happen.
Have you heard of 2 years? That's impossible.
Well, I've heard it. Also, but I've never seen it.
I've been heard of
personally. Sorry?
Funny stories, please.
So, yeah, I've heard about,
so when the baby is breached, they need assistance.
You cannot deliver that baby. Is it that the baby will go through an assisted delivery, or there are maneuvers that you can do to realign and reposition the baby and give the lady a chance, or you just have to go through the knife.
Okay, doctor, let me ask you this. So we have people who believe in getting women very early and getting girls and getting them pregnant when their body is not ready. Do you professionally, do you have a cap on the age a woman's body would be ready, so that when we are appealing to our policy makers, we should have data, we should have medical advice on the age a woman can give birth?
Okay, that's a very tricky question for me, to be honest. But what I can say is an adult can take a decision. Okay? Adulthood starts from 18 years. Get me wrong. I'm not saying that at 18 years old, that's a teenage pregnancy. Teenage pregnancy is what we want to discourage. You understand? So you discourage teenage pregnancy. You have to cross that line and be mature.
So even at 18, it's teenage pregnancy?
I mean, of course.
Yes. But 18 is 19, an adult.
Yeah, well, it's an adult, but it's a teenager. You understand? But at 18, you can take a decision what you want, because you're an adult. Like I said, you can be allowed to be stupid by law. You can, as long as you're mentally stable. There's what we call mental capacity. Once you have the capacity to take decisions, you can do. You understand? So at age, but you have to discourage teenage pregnancy, because at that time things are not fully ready, and not fully formed. Not fully formed, but not fully ready.
Let me take Balkis and I come to talk with. Balkis, thanks for calling. Are you there?
Hello, good morning.
You're live. Go ahead, please.
Yes, I can hear you.
We can hear you too.
Go ahead, please.
You say?
You are live. Go ahead, please.
Okay. Good morning.
Morning.
Please, about the process of delivery. So I noticed that when I wanted to deliver this baby, so I noticed when I was about to deliver, it was very hard for the nurses. They were trying their best to bring out the baby, and at the end of the day, the neck of the baby got stopped. So they were rushing up and down to get the doctor to assist. So before they could say, they would push, and they already caught like start of lane at least to allow the baby to come outside. So before they could say they would push and the light, in short, 2 doctors were there, and then of the day, we lost the baby.
Oh.
So I don't know how easy it would be for the first timer, because they're always saying first timer. So at least try and encourage us on how it will be easier, because we even give them to another child. I don't know how easy they will be. Thank you.
Thank you very much, Balkis.
Sorry about that.
So sorry about the loss of that child. What happened there?
Okay, so sorry about that, Balkis. What happens is, like I said earlier on, okay, let me address the issue around the first timer. Now, you talk about when is our body ready, okay, for us to go through the birth process. For the first timer, the baby's head goes through a canal at the neck of the uterus that have the baby. It's the cervix. The cervix is just the neck of it that we screen ladies for during the cervical screening. Now, that cervix has to be soft enough for it to expand and give way for the baby to come through. Now, when you have the baby for the first time, a lot of the time that area is still very thick. It's really thick. That if the baby has to go through it, it can just tear the place and then come out. So what we tend to do as a doctor is to do what they call episiotomy. So we sort of cut a clean cut of this cervix so that it would expand and it's not going to tear anyhow. So it cuts and then we can repair that. Right. You understand? That happens. That's usually happens for the first timer, just to soften that place. When you're coming the second time, the body hormone is used to as work on that area, soften it. There's that experience, and then it doesn't cause such difficulty. So I'm so sorry to hear about Beliki's case because
was it the baby that what happened? Did the baby suffocate or what happened?
So the baby cannot. You see, when a birth process is a very, very strenuous process. The baby is forcing itself or whatever, the body is pushing the baby against. So if the baby is not strong enough, they become tired. If there's a delayed, prolonged delivery, then the baby can get tired. And then there are ways that we need to assess this. This is where even training of, not only technology, even training of our people is also important for us to understand what we're picking. When a baby is becoming distressed, you understand, we need to be able to pick it early and then stop it. Stop the process of pushing the baby and straining the baby to the extent that the baby then can die, you understand? So unfortunately, it depends on the place where this happens. It might be in the rural place, it might be, but some,
Mine happened.
I'm just saying.
Mine happened in the city.
Let me take a call. I'll come to you because
I experienced
David, are you there? Thanks for calling. David, are you there?
Yes, I am.
You're live. Go ahead, please.
Good morning. Thank you very much.
Yes, sir.
I'd like to quickly make I want to ask a question.
Yes, go ahead.
My wife was 5 months pregnant. During the period, she constantly and consistently have malaria. She was finally taken to, she had a problem in Abuja, and the doctor gave her, they gave her a drip. Unfortunately, we were having an occasion the following day in the morning. So the doctor did not administer the third drip because he told us that it needs 8 hours between the second and the third drip. We succeeded in that. She then went to Makurdi. She had the same problem with malaria. At that point, they administered 5 drips within 4 hours. For me, that was very stressful to me because the doctor had already told me that she needs to have a drip minimum 4 hours, 8 hours between drips. We finally lost baby in Makurdi, 8 months pregnant. Would that have been part of the cause? Because we were told to the doctor in Abuja that cannot leave.
Thank you very much, Mr. David. So he's saying that was that stress could have contributed to the death of the baby?
No, I mean, that situation is not very clear. So I'm so sorry for the loss of the baby, Mr. David. But there are so many things that could have gone wrong there because the treatment, I do not know how much fluid they've given and what actually happened. It might be something else that's resulted in the death of this baby because giving the fluid alone cannot actually, explain the reason why the baby is lost in this
Doctor, I want
to bring it back to obstetric fistula because I know that when we start talking about medical malpractices or a little bit of mistake on the part of doctors, we would override why we are here. And really, there are many people around Nigeria, around the world, who, because lack of knowledge, have fallen into obstetric fistula. How expensive is it to get treated, and how available are the technical hands that can repair these damages when it's done?
Okay, so in terms of expenses, I have no answer because I do not know.
Oh.
But I know that, I'm sorry, it's just what I don't know, I do know. Because it's not something I can give. I can give the information later about it. But in terms of the availability, there are specialists who are capable of doing this. There's still need for training of more people, more hands, you know, to be on deck here. Because I look at the data. If we look at the number of people that are suffering from this disease in this country now, we need about, with the number of doctors that can operate as it stands now, we need about 83 years for us to do the backlog. And every year we're having about 50,000, 100,000 people falling victim of this, you know, on yearly basis.
So we don't have enough doctors and we have so many patients.
We have so many patients.
Would you suggest as a preventive that we copy methods abroad where default methods of having your child is by cesarean section? My consultant said that's the safest method where you get mother and child out and they're safe. And, you know, and let people opt for natural delivery because of the possible consequences of it for children. We also know that cerebral palsy is also due to natural. There's so many dangers having. Would you suggest that policy be put to place?
Well, I think it's like I said earlier on. When a patient comes to me, I see the patient as a customer who I need to engage. Well, not even as a customer, as a partner, who I need to engage in a process of discussion for us to reach an agreement. Decision to do a cesarean section is not, I won't advise it by default because cesarean section has its own problem as well. It's an operation. It's a major surgery that you're talking about. Things go wrong during the surgery as well. People lose their life. You could lose the baby. You could.
What are the chances between that and natural delivery?
Well, the chances between that and natural, if you do anything natural is natural. The risk is lower when you're talking about something natural. What we need to be looking at is how do we prevent, what are the things we need to put in place as in educating the ladies, putting structure in place where if there's an emergency, people can easily be attended to because we don't have enough emergency you know, centers where people can actually be taken care of to prevent the prolonged, you know, labor. And then they're moving, people that are affected, they will be in a place where they have to travel.
Are you being commercial?
I'm
see, I have had...
commercial is to go do CS now.
You know, you're considering money.
No.
I have had a natural delivery.
Exactly.
Yeah. I've experienced both.
Okay.
And I think the safest is a CS any day, anytime.
For you.
But I've sat through with patients. I've stayed 6 months sitting with mothers in a prenatal ward. I've seen what they go through. I've seen mothers cry after a 9 months pregnancy and their babies are brought out stillbirth when it could have been prevented. I think we should not pay...
I've had 2 natural births.
Can I say something? Okay, let me tell you something. There are people that would detest the discussion of an operation.
Yes, they do.
And they are
for lack of better knowledge.
They are even more.
Yes, they do.
People that will want the surgery like you. But if you then say, okay, go for surgery, have you forgotten that you are going to touch on those people's mood and emotion?
For lack of better knowledge again.
No. I don't think so.
There are different areas.
Yeah. Yes.
Anesthesia. Some people come back and they come back paralyzed or something different.
Yes.
I've had that situation where natural birth was easier for me. I know the pain I went through 2 years after the C-section. So they're different, depending on who you're talking to.
And I think we should let the professional advise at every point in time. And what we should advocate is women, listen to your doctor. If your doctor advises that you should do CS, do CS. If they say you can do
questions,
a friend.
ask questions.
There are 9 siblings. All 9 of them popped out naturally. Their mother never went through CS.
Yeah, but the thing is, natural birth is even better after the second, the third one. It's easier.
It becomes easier.
Doctor, I beg to differ. So every baby comes with his own style and challenges.
Yes.
I had natural births for the 3 of them. First, second, very easy. Go in, pop it, and come home. The third got very big. The scan didn't say. We didn't know till I got there and the head got stuck. Exactly what Biliki's experienced. The saving grace was that the baby was still very strong. She came out blue. Kaima.
Wow.
She came out blue and she got an injury, her nerve. We had to start doing physio for years. I knew what I saw. And, you know, so sometimes everything is planned well, but it doesn't happen the way it's planned. And because they couldn't detect that the baby was very big, she came out at 4.6 kg, was very big, we got stuck. So at that point, what do you do? Was it at the point that her head was out that I should have been taken to For CS?
No, so it's all in
Beyond
stages.
us.
It goes from one stage to the other. When you go into labor comes phase 1, phase 2, phase 3. So when you're phase 1, you're assessing phase 2, you're assessing phase 3, then you know. It's just, what we need to be talking about here is the ability for us to pick signs early. Do you understand?
Technology.
And again, the third baby is usually
Bigger.
They're bigger.
I didn't know. They didn't
they're
advise
usually bigger
The
than,
first
you
was
know,
bigger.
yeah. So it's, I mean, when you look at research generally,
Yeah.
okay, and yeah, 4 point something, that's quite,
She was
quite
big.
hefty.
Her clothes inside her. They had to enter the market to buy clothes.
All right, we have to wrap up. But I think generally, I just want you to final words on the obstetric fistula. You didn't want to talk about the numbers, but the truth is that it is curable, which is important.
And expensive.
People must be willing to take that surgery the moment they detect or diagnose something that can be fixed immediately.
They can
I see
afford
something.
it.
You know, when you talk about the expense, truly I do not know how much it will cost, but what I realize in Nigeria is the fact that, people struggle because we're doing out-of-pocket payments. You understand? It's very hard for people. It's hard in this country to take care of people to be sick.
Yeah.
It's very, very hard. Unless you have it, it's really, really hard.
And
And people, you have to pay. And if there is a system whereby you don't pay out of pocket, there's an insurance system that we can work
That's
on.
a whole another kind of worms. Because it was in papers to the NHIS. There's always one thing or the other. So we have to wrap up. But you're right. Here, it's not easy being a Nigerian because we have to pay out of pocket for our land.
Almost everything.
We pay for our housing, pay for our car, pay for our health. We don't have a system to help. So that's our story. But unfortunately, thank you very much, sir.
Thank you, sir.
For joining us this morning. That's all we can take on the show today. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.